Nowadays, one of the most common and threatening issue in our community is hypertension. Wait, what? You don't know what is hypertension? Well, okay, nothing to worry about, cause I will tell you the whole of hypertension. Let's move in. Hello everyone, I'm back with another informational video. And first of all, please do subscribe my channel. Before knowing hypertension, we must know what is blood pressure. Blood pressure is the force exerted by the blood against the walls of the blood vessel. When there is any elevation of the normal blood pressure, which is 120 by 80 mm of Hg, is called elevated blood pressure or hypertension. World Health Organization classified hypertension in different stages according to the levels of blood pressure, which includes normal blood pressure includes systolic blood pressure 120 and systolic blood pressure 80. And the next stage is elevated blood pressure, which is systolic blood pressure in between 120 to 129 and diastolic blood pressure less than 80. Hypertension stage 1 includes systolic blood pressure within 130 to 139 and systolic blood pressure 80 to 89. And the last stage is hypertension stage 2, in which systolic blood pressure is greater than 140 and diastolic blood pressure greater than equal to 90. Now we will get to know the risk factors which can precipitate the happening of hypertension, which is divided as modifiable and non-modifiable. Modifiable factors are those factors which can be modified and reduce the happening of hypertension. In this category, it includes obesity. Data indicates that when people with high blood pressure lose weight, their blood pressure generally decreases. The greater the weight gain, the greater the risk of high blood pressure. Next is salt intake. Data says that high intake of salt increases the risk of hypertension. Next is saturated fat. The evidence suggests that saturated fat raises blood pressure as well as serum cholesterol. Next is alcohol. Data also says that high alcohol intake is associated with an increased risk factor of hypertension. Others are also include physical activity, which can increase hypertension, and also environmental stress. The term hypertension itself implies a disorder initiated by tension or stress. So we can say that increased stress increases the risk of hypertension. Hypertension can secondarily caused due to oral contraception. Now we will move into the non-modifiable factors, which can never be modified and can increase the risk of hypertension. First of all, age. Blood pressure rises with age in both sexes and rise in greater in those higher initial blood pressure. Next factor is genetic factors. Next factor is genetic factors. Genetic factors are mostly known as precipitating the hypertension. Next is sex. Early in the life, there is little evidence that in the male there is display of higher average level of hypertension than female ones. Population studies have consistently revealed that there is higher blood pressure levels in black community than other ethnic groups. Now we will know what are the clinical symptoms by which one will get to know that he is suspected with high blood pressure. Well, primarily hypertension is asymptomatic until it becomes severe and targets various organs. And its secondary symptoms include fatigue, dizziness, palpitation, angina, which is chest pain, and dyspnea. The most important diagnostic evaluation for hypertension is measurement of blood pressure by sphygmomanometer and stethoscope. Now we will discuss some lifestyle modification by which we can manage hypertension. According to AHA, American Heart Association, Life's simple 7-step support ways to modify and improve health, which includes first point, manage blood pressure, which is to manage blood pressure. Second, control cholesterol. Third, reduce blood sugar. Fourth is get active. 5 is eat better, which is to eat balanced diet. And 6, losing weight, which is reduction of weight by physical activity, etc. And lastly, cessation of smoking. According to American Heart Association, among the lifestyle modification, one of the greatest modification is weight reduction. Weight reduction has a significant effect on lowering BP. Whenever a person decreases calorie intake, sodium and fat intake are also reduced, although reducing the fat content of the diet and also reducing our blood pressure. One of the most important lifestyle modification is restriction of dietary sodium reduction. One healthy adult should restrict sodium intake to less than or equal to 2300 mg per day. According to American Heart Association, the hypertensive patient should emphasize a special diet named DASH diet, which is dietary approaches to stop hypertension. The DASH eating plan emphasizes fruits, vegetables, fat-free or low-fat milk or other milk products, whole grains, fish, poultry, and nuts. Along with these, other lifestyle modification includes a physically active lifestyle, which is essential to promote and maintain good health. Another one is moderation or cutting of alcohol intake and cessation of tobacco products. And now we will discuss the drug therapy which is needed to treat the hypertensive patient. So first of all, we will discuss who do need the medicines. Well, the patients who are 65 years or older with an average systolic blood pressure of more than 130 mm of Hg may need medicine and other follow-up treatment. Medicines which are given to treat hypertension are named antihypertensive agents, which are we will be right there in my channel with all the group of antihypertensive drugs in details. So till then, to subscribe to my channel. Thank you.